Now, the next area is the minors or the ambulatory care area. Now, currently due to the COVID situation, we have converted the minors area into an isolation zone for COVID patients, which means we have given up 5 cubicles and the ED footprint has shrunk further. It makes it very difficult for our day-to-day functioning of our department. So by having this new build of the proposed minors, we actually generate 7 cubicles, and what that does is actually freeing up space for majors patients. Those are patients who require, who are critically ill and require continuous monitoring. And the beautiful thing about this minors area is that it's flexibility. So on a normal day, it would function for treating minor illness and minor injuries, but in a COVID situation, it would double up into an isolation zone. It forms the first phase of the escalation plan for our COVID plans. So what does this area really have is we have a large cubicle and a direct access into it. So what this does is suspected COVID patients can be brought in directly into the cubicle through an external access ramp. Even direct walk-ins can come in through that. So this prevents the risk of infection to the others in the department. And not only that, the cubicle itself is resus capable, which means that if the patient is critically ill, he can be resuscitated in this area. As you know, this cannot be done anywhere else. It has to be in a safe environment, and this particular room does adhere to infection prevention and control norms. The rest of the cubicles can now take a trolley, which means that we can admit suspected COVID patients, and there's going to be a good flow through the area, which means that we do not compromise the safety of the patients around us. It also has dedicated donning and doffing rooms. So what we have done in essence is that we have future-proofed our emergency department to face COVID, and we know that COVID is here to stay for a longer period of time. And not only for COVID, but any CBRN or major incident. Finally, the third area is the GP assessment area of the urgent care center that will continue to cater to urgent primary care needs.